The battle between the Trump administration and Big Pharma heating up this week as the transparency of TV drug ads comes into question. Meg Tirrell is here with more on the story. Hi, Meg.
Hi, guys. Well, TV drug ads can be scary enough, as we've been talking about, with all sorts of side effects. The list is as long as your arm. Now, the Trump administration wants drug companies to include the list price of their medicines in the TV drug ad itself, actually having in print at the bottom of the commercial what the list price, the sticker price before any discounts or insurance kicks in of that drug. Now, the pharmaceutical industry is not in favor of this. They actually came out with a proposal themselves yesterday, hours before the administration proposed this rule, saying we'll direct to a website with some information about the list price and the discounts and the patient assistance that you can get there. Their argument is that the list price is not a real price that anybody pays. They say this could mislead patients about how much they'll pay for their drugs, which could actually deter patients from going to the doctor and seeking help or even trying to take these medications. They also say this might infringe on their First Amendment rights. But Secretary of Health Alex Azar was on Squawk Box this morning, and he addressed that list price argument, and he doesn't agree. Here's what he said.
The problem is almost every single senior under Medicare pays the list price or a % of list price on at least some of their drugs. 47% of Americans under the age of 65 have a high deductible health plan, and during that deductible, they're paying the list price. So I'm not buying the pharma talking point that list prices don't matter. They do matter.
And the tone here coming from the administration is pretty fascinating. So he actually used to be a top executive at Eli Lilly. He really knows the ins and outs of the drug industry. And it looks like this might shape up to be a potential legal battle. But one analyst, Jeff Porges over at Leerink, says this could actually be worse for another industry, our industry, the broadcast industry, because it may actually cause drug companies to stop TV drug advertising altogether. That was $5.8 billion in revenue for broadcast networks last year. That's how much drug companies spent as a whole, according to Kantar. And in terms of the biggest advertisers, you've got Pfizer spending almost $500 million in the first half of 2018 alone, followed by AbbVie, Eli Lilly, AstraZeneca, Novo Nordisk, all sorts of other companies. These guys spend a lot of money on this, and it might not be the drug companies that really get impacted here. It might be broadcast networks, TV.
Wow. All right, Meg, thanks. Meg Tirrell. Well, this, comes at a very strange time because Tim and Guy here are actually starring in their own drug commercial, which was supposed to debut during the Super Bowl, but we do have a sneak peek. Take a listen.
Do you go to bed and wake up in the morning? Well, now there's a cure for that. Lostrex. It's your key to everlasting happiness. It will rewire the neurons in your brain so that you can be the new you. Side effects include insomnia, heart arrhythmia, bleeding from the eyeballs, sudden urges to eat street food, the false belief you can talk to animals, magenta urine, and spontaneous singing of Beverly Sills songs. Consult your doctor and get Lostrex today and be the new you.
Oh. And now I guess the administration wants to put the list price on that ad on top of it.
It costs.
Yeah, there's no price you wouldn't pay, list or otherwise, for that kind of happiness.
It's just, it's tough walking around Times Square with a good friend and just feeling some of these side effects. I mean, we're doing our best to keep it together, but
we're pitching that, by the way. I mean, it's highest bidder. I know the folks at Pfizer and Lilly and Bristol. Highest bidder can have it. I mean, there's no doubt about it. And they're back there in their war room saying,
calculating.
What do you think they're going to do with it? They're going to
once they get it. I love the way those two guys ate that pizza.
Yeah. Here's a serious question, though. To Meg's point, is this a drug stock story or is this a media stock story?
Drug stock story, but as it affected them, I think much of this is in a dialogue that we sort of exacerbate, make it much bigger than it is. Eli Lilly is up 31%. Nothing seems to stop them. Pfizer's up 21%. Merck's up 26%. I think that they'll be just fine.